Hi, this is Dr. Walker. Welcome back to the channel, denwalker.com. So this past week, I've had several folks asking me what is the, quote, treatment for a fast heart rate. In fact, one gentleman, his heart rate was, for more than a week now, it was 182 to about 190 thereabouts. And he said that just walking to the car, sometimes the heart rate goes up to over 200. That's not normal. Now, one of the I'll back up. Before COVID, if you were to ask me the list of things that causes a fast heart rate or tachycardia, it was some of the pretty common things: caffeine, stress, hyperthyroidism, or high thyroid function, if you would, adrenal concerns, dehydration, or just regular sickness, can all cause or lead to a fast heart rate. But your heart rate should not be 110, 100 for a long time. It should not. Most people's resting heart rate somewhere between 60 and 80 thereabouts, and so probably on an average maybe 70 or 75 thereabouts. But it should not be 110 or 180 in his case. Now, in COVID, one of the things that we realize or recognize is that the COVID or a vaccine or a shot, the spike production or the spike protein production have sort of an affinity for the heart or areas of the body that has high ACE2 receptors. And the heart happens to be one of those areas. And so sometimes the spike protein can then get to the heart muscle and cause inflammation, myocarditis, or the outside of the heart, the pericarditis, inflammation of either one of those two things. But that inflammation in and of itself can cause you to have a fast heart rate. So again, myocarditis would be one of the big concerns now during COVID that one should be concerned about. So to ask me what the treatment for myocarditis is or for a fast heart rate, that's not the first thing to do. Perhaps the first thing you should do, and in fact, not perhaps, the first thing you should do is see your doctor and have them they can do cardiac enzymes on you, looking at the troponin levels, for example, or do an EKG, essentially looking at any abnormal heart rhythm or ST segment changes, if you would, that would sort of indicate that there's something more ominous than just a fast heart rate. From things like dehydration, for example, where just you drink fluids and you'll be fine. That's not the issue here. The issue here is that you need to first exclude something more ominous happening to your heart or to your body than just the pre-COVID benign sort of things, or things that could be easier controlled. The thing now to control, or thing now to understand, is to be certain that your fast heart rate is not secondary to a heart problem, and that heart problem, if left unchecked or undiagnosed, could lead you to fatalities and so forth. So be certain that if you have a fast heart rate, and for me, anything greater than 100, for greater than a couple of days, I would go and see your doctor and have them run some exams on you and see exactly what the cause is. And if the heart's not the issue, if there is no myocarditis or pericarditis, then they could begin to look into other things like caffeine and dehydration, adrenal issues and stress and those kind of things, and get you fixed up. But the key thing is to be certain, get your heart checked first. Thanks for listening, Dr. Walker.